Jazakumullah jaza for that great introduction. So I'm going to begin. I'm going to put the timer on here because I know I only have 10 minutes, which is not nearly enough to discuss this topic, but we'll try to do as much as we can. So first I want to thank the AMMA as well as Dr. Amnat Tariq for inviting me to this conference. It's an honor to be here. Jazakumullah. I have learned quite a lot through the past couple days, and I'm looking forward to learning more. My name is Dr. Talha Farooq, and I'm a chiropractor and medical acupuncture provider. I practice in Toronto. My clinic is Performance Therapeutic Care. On a personal note, I'm married to a beautiful wife, and we live in Woodbridge, Ontario. This is a little bit of background information about me. When I first started going to my undergrad, I wrote a letter to Huzur Anwar, and under his guidance, I completed my 4 years of undergraduate education in Kinesiology and Health Science. Then I went on to do my chiropractic school, which is a 4-year program in Canada. So just keep in mind, this presentation is going to be pertaining more to Canada because I am from there. So it might vary from state to state. And then when I went to go visit Huzur Anwar, and I told him that I'd become a chiropractor, he said, "Acha, to phir acupuncture bhi kar lo." So then I went on to do my medical acupuncture certification. So the way that I did acupuncture is a little bit different from Dr. Irfan. This is medical acupuncture. It focuses on neuromodulation, and it focuses on nerves, bones, joints, specifically focusing on the anatomy within the body. I also did, in the past 6 years, I've done many certification courses, specifically focusing on rehabilitation and exercise. And this is, again, a mandate as per our regulatory bodies to do continuing education, to keep up with the most up-to-date research that's coming out right now. So let's have a little bit of fun. So I want you guys to complete the sentence here. So we have Dr. Tariq, who is a surgeon who practices surgery. We have Dr. Ahmed, who is a dentist. He practices dentistry. And then we have Dr. Farooq, who is a chiropractor who practices, and if you said chiropractic, you'd be wrong, because it's chiropractic. It's just a little bit of a syntax there. But it's okay, if you didn't get that one, we'll give you a second chance over here. Chiropractors specialize in what? So by show of hands, A, manual therapy. Okay. B, adjustments. Okay, we have one person here. C, the neuro-musculo-skeletal system. Perfect. And D, alternative care. Okay, so most of you got that right. We are experts in the neuro-musculo-skeletal system because all we do in our 4 years is study the NMSK system. So now I'm going to present to you a case in my practice that walked in about 3 months ago. And this is a case that I want you to really pay attention to because it's often misdiagnosed and mismanaged. So we had a 27-year-old patient. He's a law student. He comes in complaining of chronic low back pain. He's been experiencing this back pain for about 3 years, and he tries to live an active lifestyle, but complains of pain when he's sitting down, when he's at the gym, when he's coughing and sneezing. So now, just take a minute to really appreciate this case because this patient is a young male, 27-year-old. He cannot sit down and write his exams. Obviously, we all know how much schooling we've done here. And just imagine writing an exam for 3 hours. You can't sit, you're fidgeting. So he's not able to do that. He can't live an active lifestyle because he's not able to go to the gym because he has pain while he's squatting. And now he believes he's going to have pain for the rest of his life. So this is a very debilitating scenario that I see very often in practice. So he also complains. So this pain actually started about 3 years ago when he was deadlifting. And he complains of radicular type pain, which is pain that travels from his low back into his glutes and then down the left leg. We also performed an outcome measure in practice, which is a very common practice that we do. Outcome measure specifically focusing on the low back called the oswestry, and he scored a moderate disability. And this is an objective measure we use which helps track the patient's progress. Because obviously subjectively the patients can say, I'm improving. But how do we objectively measure that? And this is one of the ways that we do that. We also screened him for red flags, and he had none. So at this time, I want you to take a minute and think about what this patient is experiencing. So just keep that in mind as we go on to present the physical examination. So upon the physical examination, actually, first of all, before we begin this, how many students are sitting in this session? Can you put your hands up? Okay, so we have 2 here. So this is actually very important for you. I'm going to tell you why in a second, so just pay attention. So upon observation, he was complaining of lateral listing. What that means is the patient is shifting away from the left side to shift away from the pain. He also, upon palpation, he had hypertonic lumbar erectors, which are the lumbar paraspinal muscles, as if they were protecting that region. Upon orthopedic examination, he presented with a positive straight leg raise test and a Braggard's test, which essentially are nerve tension tests of the back and the sciatic nerve. He also had a positive Valsalva test, which is which is a non-specific test, and it increases the intrathecal pressure inside the spinal canal. He also had a positive thigh thrust, which again is a sacroiliac joint test that we perform in practice. And he also had decreased hip ranges of motion. And this is for the students. So sometimes in clinical practice, you're not going to get those textbook cases, right? You're going to see that it's not always what it seems to be. So in this specific case, as I mentioned before, this patient had a radicular pain going down into his legs. So in a textbook case, he would have positive, most likely positive neurological symptoms or a neuro exam. But in this case, it was all normal. So then we had to perform a couple other tests. So we put him through a couple of movement screens, the FMS and the DNS. And in the DNS, we found that his core activation muscles were not turning on. So again, this is because his primary back muscles were turning on to protect that region in the lumbar spine. In the FMS testing, again a movement screen, we found that this patient, when he was squatting down, he was again shifting towards the right side away from the pain. So with this physical examination, think about a few differentials that you would work with. So this patient did in fact have a left-sided lumbar radiculopathy, specifically due to a disc bulge. That was our working differential that we arrived at through our physical examination. After this, we have to come up with a comprehensive treatment program for this patient. So in practice, we follow the evidence-based practice model, which stands for EBP. And in this model, we follow 3 facets, right? This is, again, comprising of holistic care. It comprises of patient values, the best scientific evidence available for that specific condition or differential, as well as the clinical expertise of the clinician. And based on that, we arrived at a treatment program for this patient, which you cannot see, but I'll tell you out loud. So we had 2 components in this treatment program. The first component was a passive component. In the passive component, we performed mobilizations of his hip. This is where we take the hip and we kind of open the hip to increase the range of motion. And this is due to us trying to alleviate pressure off of the lumbar spine. So remember, this patient had trouble squatting. He had a decreased hip range of motion in the physical. So we helped open his hips up through mobilizations called Mulligan mobilizations. We also performed manipulation of the spinal, of the lumbar spine. And again, this is because we want to release tension of the lumbar erectors. And spinal manipulation allows resetting of the Golgi tendon organs and the muscle spindles within the muscles. Then we also went on to do some soft tissue therapy on this patient, which comprises of, again, releasing some of those tight lumbar erectors in his low back. And we also performed some electroacupuncture in the glutes, because often in these types of cases, patients present with basically no glute activation. And again, this is because the primary extensors are the lumbar erectors. They're hyperactive in this situation. Along with that passive treatment, we performed an active treatment program. And the active treatment program complemented the passive treatment program. So we prescribed him exercise rehabilitation, where this patient was put through hip mobility exercises to maintain that mobility we achieved in our passive treatment. And we also prescribed specific core exercises to, again, engage his core muscles to take the tension off of his low back. We also provided some movement strategies so this patient does not continue to elicit that type of pattern which causes pain in his low back. And we also performed other movement strategies for this patient. And again, this was the gold standard treatment for lumbar disc herniations as per the research today. So again, keep in mind, this patient, 3 years of pain, this was resolved in a matter of 3 months. So again, the proper diagnosis and a comprehensive treatment strategy and treatment program comprising of active and passive treatment modalities focused on the evidence-based model is the best way to treat patients that come in with this type of issue. So this is just a kind of take-home message for you guys that chiropractic is not a technique per se. We are experts in the neuro-musculo-skeletal system. And again, our jobs as doctors is to primarily diagnose first, because if you miss a diagnosis, you're not going to be able to treat this patient as per your job. We also use different tools and different modalities to examine the patient. And again, this is for the students that, sometimes we can't always save the day. So we sometimes have to refer out. This is when we refer out. If the patient's symptoms are progressing, we can do referral to ortho, neuro, or rheumatologist if need be. And again, in Canada, chiropractors are primary care practitioners, and we specialize in the NMSK system. And again, we are trained in Canada to refer out for X-ray and MRI within the NMSK realm. And again, the most research right now is behind active recovery. Jazakumullah, thank you very much for listening to me. This is my contact information. If you want to write it down, if you want to reach out to me, please feel free to do so. I'm also on Instagram at Performance Therapeutic Care, and I have a LinkedIn page as well. So if you have any questions, we can take questions now or later? At the end. So we'll take some questions at the end. Jazakumullah.
Just also, because he is so humble, Dr. Farooq, he is experienced chiropractor, doctor in the field of chiropractic and physical medicine, holds the BS with honors, degree in honors in Kinesiology and Health Science from York University, and then pursued academics, obtaining his Doctor of Chiropractic from CMCC in Toronto, as well as medical acupuncture from McMaster University. He's a clinic owner and director at Performance Therapeutic Care in Brampton. He devotes his clinical time to assessing, diagnosing, and treating neuro-musculo-skeletal conditions. His movement-focused approach has led him to successfully treat numerous amateur and semi-professional athletes at his practice, enhancing their performance, aiding injury rehabilitation and prevention. On a personal note, Dr. Farooq serves as the Nazim First Aid for regional events as well as national student affairs in Canada. He's married and lives with his wife in Woodbridge. Dr. Farooq embraces an active lifestyle that reflects his dedication to physical fitness and personal growth. He currently plays in ice hockey and soccer leagues. He also enjoys the outdoors through backcountry camping, skiing, fishing, and hunting. And maybe now with the fires, Mela, keep us all safe.